The advocacy group for doctors has now released what they're calling a roadmap to address what they call a critical shortage of doctors here in Iowa. KCRG TV9's Molly Swain joins us live in the studio with that story. Molly, how are they working to bring more physicians here to Iowa?
Well, Becky, it comes down to this report. It came out of a meeting of the Iowa Medical Society. Doctors from across the state came together to brainstorm solutions to offset the labor shortage. Doctors in Iowa are calling it a crisis.
Iowa is 44th in the country in the number of physicians per capita.
A shortage of doctors in the state right when there's about to be more demand than ever. Dr. Gerard Clancy at the University of Iowa said people use healthcare services the most around age 77.
And right now, only 11% of baby boomers are older than 77 years old. So we have a huge 89% of baby boomers are coming toward the healthcare system right now.
I asked Clancy why this nationwide problem is pronounced in Iowa.
It's an uphill battle. We don't have mountains. We don't have beaches, our issues. And so part of the summit was, how do we make Iowa overall more attractive for a physician to come and stay as well?
The summit Clancy mentioned happened in December. There, leaders in Iowa's healthcare community tried to come up with ideas to make Iowa more attractive to doctors. One suggestion, give more Iowa medical school graduates a path to stay here. Nearly 400 med students graduate every year in Iowa.
But we only had about 280 first-year resident positions in Iowa.
In her Condition of the State address earlier this month, Governor Kim Reynolds said she was directing the state to secure $150 million of federal money to add 115 new residency slots. She's also tackling huge med school loans.
I am proposing to consolidate our loan repayment programs and double our investment to $10 million.
Clancy said being a physician is a, quote, noble profession that he's loved for 40 years. But over the decades, he's seen the profession change to the point where something has to give.
These are long days, and there's a lot to do, and the intensity of the work that I go through personally is more than it's ever been.
Clancy and I discussed a lot of other options to address the shortage, including working with insurance companies to make it easier to give patients the care they need. In the studio, Molly Swain, KCRG TV9 News.